Do not ignore this if you collect Social Security or Medicare, as if you haven't seen it already, this video is spreading like wildfire, as last week in the House of Representatives, David Schweikert, he explains just how bad the solvency issue is, and he says it's actually not Social Security that we should be worried about. The big trouble is with Medicare, and wait till you see the charts. And he's saying it is depleting faster than people are realizing. We have got to do something, and wait till you see the 10-year projections that he shows. Absolutely incredible, the deficit that is coming out of these. Now, also, at the very end of this, he apologizes and says, if I hurt anybody's feelings, I'm sorry. I guess I'm just too caffeinated, and I'm too cranky and sick of people ignoring this, because the problem, it is getting severe, and we are nearing the end. And that is probably why I've been letting you guys know we have heard that 2023 was going to be the year of Social Security reform, but he's saying it's not that. Medicare is the main one that is the problem here that needs to get fixed in soon, because if not, we're going to be having some serious issues here. Now, I'm going to share with you the actual video footage so you can see it for yourself. And like I said, it's spreading across like wildfire. So do me a favor. Before we dive in, smash the like button, hit subscribe to stay up to date. As more information rolls out on all of this, I'll be sure to let you know. And like I said, they have got to address these issues here very soon, because time is running short on these. Let's go ahead and take a look. Let me know your thoughts. Stick around to the end. You're going to see him break down Social Security, Medicare, and the deficit, how much time we actually have left.
So let's actually go over some of the other comments I get over and over and over and over, particularly when I've talked about Social Security. And this is back to the cruelty the Democrats and the press have been doing this last 2 weeks, trying to light people's hair on fire with basically, what's the proper term? Oh yeah, lies. For the average American who's going into Social Security today, remember, I keep seeing these comments, if I could just get all my money back. Okay. If you were willing to make a deal with the Republic, saying if I gave you back all your money on Social Security and Medicare, would you sign up for that deal? Because we'd take it in a moment. Because when you see what you get back, you realize this is actually where much of the structural deficit comes from. And when people say, well, the money, there's no lockbox. You don't want it in a lockbox. You want it in T-bills so you get interest back. Social Security for years ran a surplus. That was building the trust fund because we had this demographic bubble coming called baby boomers. We saved and saved and saved and saved. And then a couple years ago, we started having more people move into retirement than functionally what they were paying, workers were paying. And so every month when the check goes out, you take the FICA income that's associated with the old age survivors system, the Social Security system, send that out, but we needed a little bit more. So Social Security would take its Treasury bill, present it to the Treasury. Treasury would give them cash plus some interest. For many years, the interest rate was actually a spiff over higher what you would get on a market T-bill. The money wasn't stolen. It was put into T-bills, just like you might do with your extra savings. Stop making stuff up. So the average American, the typical retiring couple, let's do it that way because it's easier math, will receive, well, let's not do the Medicare number. Let's first do the Social Security. That couple, the average, over a lifetime of work, so this is 35 plus quarters, sometimes 40 quarters, will put in $625,000 in FICA on the Social Security portion of that tax. And they're going to get back a little under $700,000. So they make a little bit of money. Now, the reality, if you had put that money in your IRA or something like that, it would have been multiples of this. And if you remember, George Bush tried to have the conversation of taking, particularly young people, allowing them to take a sliver and put it in private accounts because it would have a much higher rate of return, and the Democrats and the unions went berserk on that. But now we can look back 25, 30 years, and it would have been a hell of a lot better today for Americans if we had done it. But the politics of it is the control freaks wanting control of your money. This is in inflation-adjusted dollars, so it's like for like. You get your money back, plus a small spiff on Social Security. You could have had a lot more if you put it in markets and other places, but you get your money back inflation adjusted. Okay, that's not what drives the debt. Our problem on Social Security is our number of workers. It's Medicare. and this is hard to talk about, but math is math. And I know many people will come up to me, Schweikert, you can't talk about that. You're going to get unelected. I'm in one of the most competitive districts in America. But at least I'm in one of the best educated, smartest districts in America and understand whether you like me or not, I'm telling you the truth on the math. Here is the substantial portion that drives about 3/4 of all U.S. sovereign debt. The average couple in their lifetime of working will put in $161,000 into Medicare. Remember, the Medicare tax you pay as part of your FICA, your payroll tax, is just for the Part A, the hospital portion. The rest of the health care spending you get when you become 65 and are on Medicare comes out of the general fund. The average tax-paying couple put in that $161,000, and they're going to get back $522,000. And this number is based on sort of before the inflation cycle. We're working on some math, but I wasn't able to vet it, that the amount of money we expect in medical costs for our brothers and sisters on Medicare actually has gone up rather substantially, which that means when you say 161, 500 plus, that gap, now multiply that towards how many? 70 million Americans, 65 up, and the number grows with baby boomers? Because what, just the baby boom population is what, 76 million? You see the driver of U.S. sovereign debt. The solution is not cutting. The solution is having a revolution of the cost. Obamacare was a financing bill. It's who had to pay and who got subsidized. Actually, it was mostly about subsidizing. The Republican alternative actually spread out the actuarial numbers so you got some efficiencies, but it was still about who had to pay and who got subsidized. Medicare for All is all about subsidies, but those are financing bills. They don't touch the problem. The real problem is the cost of delivering healthcare services. And for people who might say, whoa, he's not giving us the solutions, go look at the probably 70 hours I have over the last few years on the floor here. Half those were bringing solutions. Most of my solutions are uncomfortable because they require disruptions. It's technology. It's the thing you can blow into that knows you have the flu and allowing it to prescribe. Taking on the big things, curing diseases. Turns out cures are remarkable at crashing the price of healthcare and just the basic morality of it. If diabetes is 33% of all healthcare spending, and there's chance out there that there's been some success in curing type 1 with a CRISPR-altered stem cell treatment, maybe it works, maybe it doesn't, but the literature right now says there's about 6 people who've been cured of type 1. We need to know this. We need to find out over the next decade, could it be for type 2? What do we do in the Farm Bill on nutrition support and everything else? Is that the possibility? Because if you could disrupt that cost, do you realize if you could disrupt just half of the diabetics cost in this country, you'd actually wipe out the substantial portion of the next 30 years' debt. These are moral, but they're also financial ideas, and we run away from them. It's almost easier for members of Congress to talk about cuts than it is to competition to disrupt business models. So understand, the next time you have someone saying, well, if I could just get all my money I paid back in FICA taxes, we'll make that deal, because you're getting that couple is getting hundreds and hundreds and hundreds of thousands of dollars more than they put in. It's the math. Whether you feel that way or not, it's the math. And that's the primary driver of U.S. sovereign debt. Now, look, we made this deal. This is a societal contract. People worked their hearts out. They paid into FICA. We made a deal as a society. Our job as the brain trust here as members of Congress, we've got to figure out how to make this work. Mr. Speaker, I know we're up against time. The last one I'm just going to show very, very quickly this is your 10-year chart. It's very, very simple. This is Social Security. This is the health care entitlements. This is everything else. This is the entitlement board. So this is what we're up against. And Mr. Speaker, I appreciate tolerance for everyone. If I hurt your feelings, I'm sorry. Maybe too much caffeine and too much just being cranky around here. And with that, I yield back.
A very passionate David Schweikert there. Now, let me know your thoughts in the comments down below. I think seeing those charts visually just really breaks it down as to how bad things are going to be here. We don't have a whole lot of time. They have got to fix this, and you could see the frustration. You could hear what he was saying about these issues and how, man, there have been so many lies and so many spins on things, but we need to take care of this. Otherwise, the people who are counting on this, they're going to be hurting the most. Now, I also let you guys know that just this past weekend, we heard from Kevin McCarthy, Speaker of the House, on Face the Nation. And he said they want to strengthen these programs. They don't want to cut them, as we had heard, as he mentioned, for the past couple weeks, as you saw there, about cutting the benefits, the funding. They said they're not going to be doing that. They said they're going to strengthen them. But then we heard from President Joe Biden, who said, no, Kevin McCarthy's not strengthening them. I'm going to strengthen them. But we're hearing that both sides are saying now they're going to be strengthening these programs so that way those that need these benefits are going to be getting them. And we've had several bills on the table proposed to enhance and reform Social Security. We will see. And also, as I mentioned, we're hearing the big issue is Medicare. So you guys, I will keep you up to date. Now, if you want to hear the latest about those talks that happened over the weekend, the breaking news about 48 hours ago, be sure to check out this video right here as I cover it in detail for you. You can hear the latest. I put the articles on the screen, show you the tweets and everything unfolding. But with that being said, you guys, thank you so much for joining me. I will keep you up to date on all of this as more information rolls out. Don't forget, smash the subscribe button to stay up to date, and I'll catch you in the next one. Take care. God bless. This is Steve.